Well, what brought me here and interested in being a patient advisor was the fact that I'd been using hospital services, not personally so much, but through family members, my parents and my husband and so on. And I noticed over time there were a few areas that I thought could use improvement. So I thought when I saw the ad for the applying for a position on council, I thought I'd let my interest be known. Some of the areas I felt that should be improved primarily were the length of stay in emergency department and the flow there. Another thing to do with the emergency department was I'd noticed if specifically elderly patients came in, sometimes from the nursing homes, the emergency people would have to leave them there because of course they had other calls to do, and there didn't seem to be too much attention paid because naturally the staff was busy attending to patients that were already in care, and I felt that there could be an improvement there. I also felt there could be some improvement in just the way patients were discharged. As far as how we were received when we became members of the council, I was very impressed. Dr. Roy and the senior management staff, and actually all staff, really welcomed us and made us feel welcome, and we all, I believe we all had the sense of being heard, and even in all the committees that we were in. Some of the positive changes, primarily one of the first changes was that when I go back to talking about people waiting in the emergency department, we established, or the staff heard our request and established navigators in the emergency department, people that would, volunteers that would scope the emergency department and be observant of the patients or families that were waiting there to see if they had any special needs, like maybe needing a warm blanket or some nutrition if there was a diabetic patient, things like that. Some of the other things I find now, there has been improvement through the expanded care transition group and through the patient access and flow committee that I was on, where they're improving the discharge process. I thought that there was a lot of need there in discharging patients home with services that were available and information to the families on just what needed to be done. I think that there are quite a bit of, well, I shouldn't say quite a bit, but there are definitely improvements. There's always improvements to be made, and I think one of the key things I find is that there's an issue with not freeing up beds because of the long waits in the emergency department. But that goes hand in hand with maybe not a streamlined way to discharge patients home. When you discharge patients home, you need community care in place, and that in turn will eliminate or certainly reduce readmissions to hospitals, because if patients go home without the proper discharge plans in place, 9 times out of 10 they'll come back, if not for a short time, for a longer time, and it all goes hand in hand with cost effectiveness, but certainly the comfort of the patients and the well-being of the patients. The advice I'd give anyone that might be interested in becoming an advisor would be to don't fear the process, because when you come here, it's giving you an avenue to make your concerns known. So come with an open mind, but also come with a determination that you're going to bring the concerns of the community or your personal and family concerns to the table, because they will be heard. And it's a perfect avenue to help and be effective in making change in the way the hospital patient care and patient-centered care actually becomes more prominent.